Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hi everyone, and welcome to ATP Hour. I am Bimi Salaboide. I'm a pediatrician, and it's my pleasure to be here with you today. On whichever platform you're watching me, whether you're watching on ACP Facebook group or you're watching us on YouTube or Instagram Live, I want to say thank you so much for joining me today. I also want to especially welcome those of you who are joining us on Fresh Waves Radio or who are listening on Access to Mimi ATP podcast. Thank you so much for joining us today. Today is a special twist on ATP Hour because on the 13th of February this year, we celebrated what we call the International Epilepsy Day. This is a day set apart for us to talk about epilepsy, to create awareness about epilepsy. And so it's befitting that we should revisit the topic, even though it's something that we've talked about quite a long time. And yesterday, that was on that same day, I hosted a session on our Facebook group where I allow people to ask me questions live about epilepsy. Ask any question you want on epilepsy, and I hosted this across 3 of Facebook groups that I'm part of, on Ask the Pediatrician, on ATP Family Facebook group, and on Super Parents Facebook group. And lots of parents and members were asking several questions, and it was quite enlightening, and we learned quite a lot. And so what I've decided to do is to share with you as well some of the questions that people asked. For those of you perhaps who missed that session, I believe that most of the questions we have may be similar to those that have been asked already. And so what I'm going to do today is to feature some of these questions people have asked about epilepsy, and then I'm going to give you the answers to them. And of course, I've done a lot of teachings on epilepsy before, which is available on this same platform you're watching on. Or if you're not sure how to say, just go to my podcast. So there's an ATP podcast on epilepsy, and which I did last year. And there's also one on myths and facts on epilepsy. So I want to encourage you to either listen to them or watch them on our YouTube channel. So if you want more in-depth knowledge on epilepsy. But today I'm just going to give some facts on epilepsy, because this day is about creating awareness on epilepsy. And after giving you the facts, then I'm going to now start featuring those questions, and then we can answer them. So thank you so much for joining me this day, whatever time of the day you're watching on. And please help us to share the link, share the videos to your friends. These are very, very important, and it is one condition that we should all know about. And from my experience answering questions on the 13th of February, I still see there's still a lot of beliefs and superstition and mystery around epilepsy, and that is why it is important that we have this session where we can just talk about it. And if after the program perhaps you still have questions that I have failed to answer, don't worry, you can always send us your questions either to Ask the Pediatrician Facebook group. You cannot miss our group on Facebook. Just go to Facebook and search for Ask the Pediatrician, and you should be able to get into our group. and you can post your questions there, and we will try and answer them for you in at least 48 to 72 hours. Most time we do it in less than 24 hours. Also, you can email me at askthepediatricians@gmail.com or Dr. Gwimisala at askthepediatricians.com. I'll be very happy to get your questions and we'll try and answer them. You can also read about epilepsy conversions on our website www.askthepediatricians.com. So there are many opportunities for you to learn and for you to ask your questions in case they have not been covered in this podcast or in this session that you're watching. And even any other questions that has to do with the health of your children, you can always ask us on Ask the Pediatricians Facebook group, and we'll be very happy to answer them. So thank you so much for joining us today, and I hope you will stay tuned and you can learn a lot. This program is brought to you by Ask the Pediatricians Foundation, and we're committed to the health and to the welfare of all children globally, but especially in Nigeria and sub-Saharan Africa, where most of our children are still die from preventable things and treatable conditions. And we do that through this health education and information programs. And interestingly, epilepsy is one condition that is not just for children. So yesterday, I have questions from adults, I have questions from parents of children. So it's a condition that affects all age groups. So I think this broadcast is not just for children or for parents of children, it is for everybody. So welcome once again. So like I said, today we're going to be talking about epilepsy, and it's more of a Q&A session on epilepsy. And these questions are questions that people asked live. These are real questions. So don't be surprised. Some of those questions look like they were repetitive, because what I did was to just copy and paste just as they were asked, and some of them obviously were similar, but I'm sure through these questions you'll be able to learn a lot. And of course, I've not selected all the questions because I have just 1 hour, so but I believe that people ask the most important questions first, and so I'm going to stick with that. But before I go into the Q&A session, I just want to refresh our memories about what epilepsy is and to give us some basic facts on epilepsy and why it's important for us to have what we call International Day on Epilepsy, where we can actually talk about epilepsy and remind ourselves about epilepsy. Okay, the first fact I want to talk about is the fact that epilepsy is a chronic non-communicable disease of the brain, okay, that affects people of all ages. That sentence is packed with a lot of information, which I would like to break down. Number one, epilepsy is a chronic condition. Number one, people who have epilepsy have it for a long time. So epilepsy is not like malaria that you have 3 days, you've taken your medication, you are okay, and that's the end. Epilepsy is a condition that people tend to live with for years, sometimes for life. Okay, that's the meaning of the word chronic. It's also non-communicable, so which means it's not like something you can pass on through somebody else, through maybe touching them. It's not like HIV, it is not like even COVID, it's not like flu, it's not like any of those infectious diseases that we get from people by contacts or by blood contact and all that. No, epilepsy is non-communicable. And it will amaze you that one of the most frequently asked questions on the 13th of February was, is epilepsy contagious? Is it contagious? And I have to keep repeating, epilepsy is not contagious. Epilepsy is not contagious. So it's important for us to understand that epilepsy is not communicable, okay? So you cannot get epilepsy by sitting or eating or drinking from the same cup as somebody who has epilepsy. There's a lot of myths around this, which I've addressed in that podcast on epilepsy myths and facts. If you are still in doubt of this, I will encourage you to listen to that past episode on epilepsy myths and facts. So it's not communicable. It's a disease of the brain. So when we talk about epilepsy, one thing you need to know, it has to do with the brain. So epilepsy has to do with brain. It's not witchcraft, it's not spiritual, it's just like any other diseases. And affecting different parts of the body. But in this time around, epilepsy has to do with the brain. And then the next question is, it affects people of all ages, because yesterday I was getting question about, oh, can a newborn baby have epilepsy? Can an adult have epilepsy? Yes, the answer is yes. Newborn can have epilepsy. Elderly people can have epilepsy. We will talk more about that when I start to take the question. So this one sentence, as short as it is loaded with lots of information. So epilepsy is a chronic, non-communicable disease of the brain, and it affects people of all ages. Actually, more than 50 million people worldwide have epilepsy. So epilepsy is one of the most common condition that has to do with the brain. So for those of us who are neurodevelopmental pediatrician, neurologists, that's what we deal with. So epilepsy is actually our most common condition. 50 million people, all ages, adult, children have epilepsy. So it's the most common neurological disease globally. And what is this epilepsy? So people, because sometimes people get confused, and you're still going to see that from the question. Epilepsy just means having recurrent seizures, and then the next question is, what are seizures? So seizures are these involuntary movements, like involuntary episodes, because they are not just only movement, there are different type of seizures, but they are involuntary events, that can happen in our body due to the fact that the brain is a part of the brain is discharging in a way that maybe we don't expect it to. So, and that leads to, usually the most common one is abnormal movements. That may last for maybe a few seconds, so up to a few minutes. Sometimes it can last longer, and it can affect the whole body, or sometimes it can affect just a part of the body. It can be associated with loss of consciousness. Sometimes the person is aware and they are not unconscious. So, but what happens is that there are these sudden episodes that the person has no control over, and it has to do with this abnormal discharge in the brain. That is what we call a seizure. A seizure is something involuntary, something we have no control over. It's something is discharging the brain, and we can see the manifestation, whether it's an abnormal movement, or sudden fall, or sudden loss of consciousness, or loss of concentration. That is seizure. And when we now have these seizures occurring more than 2 times, then that is what we meant by epilepsy. And epilepsy has to do with recurrent seizures, and seizures has to do with abnormal discharge in the brain, and there must be no explanation for it, like maybe a fever or something like that. So that's what we mean by epilepsy. Seizures, so epilepsy just means 2 or more seizures happening, and seizures have to do with abnormal electric discharges in the brain, excessive electric discharges in the brain, or some parts of the brain. And that is what we meant. That is what we will see as seizures. And where these discharges are coming from vary. It can be a part of the brain. It can sometimes spread to involve the whole brain. And so it's very important for us to know what epilepsy is. Epilepsy is recurrent seizure. Seizure is due to a sudden episode due to excessive abnormal discharge from some part of the brain. Now, nearly 80% of people with epilepsy actually live in low and middle income countries. Yeah, you will know why that is like. So majority of people who have epilepsy actually live in developing countries. And more than 70% of these people do not need to have epilepsy, or can be seizure free if they are properly diagnosed and treated. One of the main challenges, which was coming across, which I keep saying even yesterday when I was doing this live question and answer on the 13th of February, was a lot of people in our country like Nigeria, Sub-Saharan Africa. There's still lots of myths and kind of beliefs around epilepsy that is affecting us getting the right diagnosis, affecting us getting the right treatment. One of the questions people were asking me, is there a drug? Is there a home remedy for epilepsy? There is none. And because people, when we don't have the right understanding about a condition, then we're not going to seek the right help, and that is a problem on its own. And so it is something that is the reason why this statistic is so high, that 70% of people who have epilepsy who should not be having seizures are still having seizures because they do not have the diagnosis and they do not have treatment. 75% of people, even when they have diagnosis, don't have drugs. And one of the questions that was coming across also on that day was, these drugs are becoming so expensive, especially for parents who have children with special needs. There's so many other things they're spending money on therapies. Now the drug companies are pulling out of Africa, and so those drugs have to be imported. And then we have the era of fake drugs, generic drugs, not sure they are really genuine. And so a lot of people don't get this treatment either because they don't even have the money, or the drugs are not even there, or they are just out of reach because of the cost. So this is the reason why epilepsy is still a major issue for us. And that is why 80% of those who are having epilepsy are in developing countries, and 70% of them, or 75% of them, don't even have the drugs, the treatment they need. And what is so sad is that for people with epilepsy, and which is why we have to talk about epilepsy, is that the risks of what we call premature deaths, sudden unexpected deaths in people with epilepsy is 3 times higher compared to people who do not have epilepsy. If you look at the general population, somebody who has epilepsy is 3 times more likely to die suddenly. And it was so sad because when we're having this session on the 13th of February, a lot of parents, a few people came up to say they've lost their loved one from epilepsy. One parent wrote to me, an email earlier this year, talking about one of their children that actually passed on. And interestingly, the child was no longer even having seizures, and they just suddenly passed on. So this is reality. People who have epilepsy, even when they are not having seizures, the risks of sudden premature death is still higher in them. And so that's why it's important for us to know about epilepsy. It's for us to know how to treat it, how to get the right treatment, which I will address in the Q&A session. And unfortunately, many people who have epilepsy in many parts of the world are being treated with stigma and discrimination. I remember then growing up in secondary school, even university, we used to have people who have epilepsy, and when they have seizures, which can happen anytime, anywhere, everybody just kind of take to their feet and run away from them, and then they are so embarrassed afterwards. And so the stigma, people don't want to move near them because they are afraid that they may contract it or whatever, and they don't want to help them. So there's a lot of discrimination. People don't want to give jobs to those who have epilepsy, and they are worried about what will happen to them. So all this needs to stop. We need to make sure we stop the discrimination and the stigma, so that people with epilepsy can have the right treatment. So I've talked a lot now. That just give us a preamble about epilepsy. Now let's start taking the question and answers that I got on epilepsy. Okay, so the first question I got, say, what are the major causes of epilepsy, please? So this is the most frequently asked question. So I'm going to take my time to answer it now, because when I see it again, I won't do that. I just say, listen to the first part. So what are the causes of epilepsy? Now, the truth is that 50% of the time, we don't know the cause of epilepsy, 50% of the time. So in many conditions, we usually start with common causes, and we end up with, okay, small minority, we don't know. But actually for epilepsy, we don't know. It's actually number one, idiopathic epilepsy. That is epilepsy for which we don't know why this person have epilepsy. That is the number one cause of epilepsy. So most of the time, even globally, with all our research and all that, 50% of the time we still don't know the cause of epilepsy. But for the 50% that we know, there are many things that can cause epilepsy. It could be due to the brain itself. Either the brain is not properly formed, or when the baby was being born, the brain was not well formed, or something is growing abnormally in the brain, like a brain tumor, or there's a genetic condition. There are some genetic conditions that affect the way the brain is formed. Maybe some part of the brain looks bigger than it should, or all those genetic syndromes. Or sometimes there's no physical thing you will see in the brain, but there's some genetic condition in the body, and it can affect the brain, and it can lead to epilepsy. Then, of course, infection, especially for those of us in Africa, our malaria, our meningitis, even worms can get into the brain, and it can cause epilepsy. So many other conditions, what we call metabolic conditions, immune conditions. So there are so many things that can cause epilepsy. So 50% of the time we don't even know, we can't see anything in the brain. 50% of the time we know something is happening in the brain. So let's look at what are those things that can happen in the brain that can cause epilepsy. Brain damage. For example, babies were born, they didn't cry. This is why we're always saying deliver in the hospital. Babies, when they are born, oxygen has to get to the brain. If there's no oxygen in the brain begins to die. So those parts of the brain that die, eventually when we will rush and we're able to save the baby did not die. Some part of the brain may have died from that, because the brain is one of those fussy organ in the body. Once it's gone, it's gone. It's not repairing itself. It's not like our skin or muscle or things that will grow back. The brain, once gone, is gone. But those parts of the brain that is damaged can now begin to do those excessive abnormal discharges, and which will now manifest as epilepsy. Okay, so that's number one. Or even the fact that the baby has during the delivery, they bleed in their brain, for example, like the premature babies. All these things can cause damage in the brain. Anything that causes damage in the brain. Some people are telling me, yes, their baby have what's it called, severe jaundice. It can also damage the brain. So anything that causes brain damage can lead to child having epilepsy. So a lot of parents on the super parents group were asking me, okay, they think their children have maybe cerebral palsy or have global developmental delay. Then why is the child having epilepsy again? Is it the epilepsy that is causing this cerebral palsy, or is it the cerebral palsy causing epilepsy? So, and I was able to explain to them that it is neither of them. It is not epilepsy causing the cerebral palsy. It's not cerebral palsy causing epilepsy. But both conditions have a common denominator, and that common denominator is brain damage. Once there's brain injury, there's brain damage. It can lead to either the epilepsy, the cerebral palsy, the hearing loss, the blindness. Any of those special needs conditions can happen. And the issue is that depends on how much extensive the injury in the brain is. Anything that affects the brain can manifest in many ways. Intellectual disability, all of epilepsy, cerebral palsy, global developmental, everything can happen. But it's all because there's some damage in the brain, and so they can occur together. So I've talked about congenital malformation of the brain. The brain itself is not properly formed. So babies who have hydrocephalus, spina bifida, all those things that can cause, maybe there's too much water in the brain, or the brain is the formation, during pregnancy, maybe mom didn't take folic acid or something happened. All those conditions can lead to epilepsy. Severe head injury. Okay, these are causes of epilepsy that we know, and that's why I'm always worried when mothers tell me my baby is falling, is hitting his head, and sometimes mothers say it's so flippantly, like as if it's not a big deal, and I'm like, it is a big deal for me as a pediatrician, because that head injury can lead to your baby developing epilepsy. Because when there's head injury, there can be injury, bleeding the brain, condition, something going on in the brain, and after that has gone, the next thing the child is going to develop epilepsy. Children who have accidents, road traffic accidents, they hit their head, which is why when children are riding bike, we want them to put on helmets and all that, because if they fall and hit their head, it can cause injury to the brain, and then the manifestation will be epilepsy, either immediately or further down in the future. Stroke, anything that causes stroke. Stroke basically is either bleeding in the brain, or there's blockage in the blood supply to the brain, and so basically oxygen is not getting to the brain, and that can also lead to those children have epilepsy. Like our children with sickle cell anemia, they tend to have stroke, and that can also manifest with as epilepsy. Even adults, when they have stroke, recovery they may still have epilepsy as well. Infections, of course, any infection, meningitis, encephalitis, even worms in the brain, neurocystic sarcosis, all this can lead to epilepsy. And genetic syndromes, I've mentioned them, and brain tumor. So you can see the causes of epilepsy are so many. So basically, 50% of the time we don't know. 50% of the time we know, whether it's an infection, it's a brain damage, it's a growth or a tumor in the brain. Something is going on in the brain, and that is what is causing those excessive discharge. So this information I've given to us will be very relevant when I go to another question people kept asking about: how do we prevent epilepsy? Now, the next question I'm going to ask: is epilepsy curable? Because this is what people were like asking a lot about it yesterday in different formats. Is epilepsy curable? The truth is the fact that seizures, epilepsy, remember, is recurrent seizures. We can control seizures, okay? In more than 70% of people who have epilepsy, we can actually stop the seizures. They can become seizure free, okay? So 75% of the time, we can treat epilepsy, we can cure epilepsy, and the epilepsy can go away, and we can even stop the drugs, and the people will be free from seizures. I saw one of my patients earlier this year, January. He has been free from epilepsy for 2 years, and I was so happy. You know, that's one part of my job I love so much. When I started saying, okay, it's time to stop your drugs now, I will gradually reduce it. Please don't stop it suddenly. And hopefully over 3-6 months, we can stop the drugs, and we are praying and hopeful. And most of them are able to stop the drugs eventually, and they are seizure free till today. So I have a lot of people like that who are now seizure free. But sometimes, because some of you, I know you will say, well, I know people, yes, and a lot of people were asking such questions yesterday. Yes, but in 25% of cases, we may not be able to always stop the seizures. Some people, we can control the seizures. In other words, with medication, they'll be seizure free. But whenever we try to take off the medication, they start having seizures again. So we have to leave them on medication. And some people, we don't even want to stop their drugs because we know, because there's already a brain damage, there's already injury in the brain, there's already a abnormality that we can see with our eyes or scan in the brain. We know that if we stop the drugs, it will likely have more seizures. So we don't even bother to try. And some people have very, what we call, difficult to control seizures, what we call refractory. So we try all the drugs, it's so hard to stop it. I'm sure most of you who have read Gifted Hands and about Dr. Ben Carson, who is a neurosurgeon in the US. So one of the things he does is to do surgery for such people. You know, so sometimes we have to do surgery for epilepsy. Yes, sometimes we have to use what we call ketogenic diets. Sometimes we have to use a combination of the drugs, the ketogenic diets. We have to use finger stimulation. We use all this kind of combination of treatment for some people, and sometimes we still can't get it. Fortunately, those are not many. Maybe less than maybe 1% of, very few percentage of people with epilepsy need those kind of. Majority of our children or adults with epilepsy, we put them on medication, one medication, 2 years, they are seizure free. We stop their medication and they're fine. Okay, but some very few percentage, we may not be able to easily stop the seizures, and we may even need to do other form of treatment. So that is that. But please, every seizure should be given the opportunity to be treated. So the default position, your child is having epilepsy, is having recurrent seizures, please go to the hospital, see us. We'll do our usual, ask questions, examine the child. We may do a brain scan. We'll do EEG. Most of you are familiar with EEG. It's just like we put some what we call electrodes on the child's head, and we'll kind of look for the wiring in the brain. How does the brain, electricity of the brain, how is it working? And that can tell us a lot of information. It can tell us where the abnormal discharge is coming from. It will tell us whether it's only one side or it's both sides of the brain. It will tell us, the different type of epilepsy sometimes that we can see. Immediately we know this is type. We know the right drug that go. If it's a focal seizure, this is the right drug. If it's a generalized, this is the right drug. And sometimes once we know that, we're able to give the right treatment, most of the time the children will be fine. But just let me say this, one of the parents was saying on that setting that, parents always think, oh, the child is no longer having seizures, so why should I keep giving medication? And they just stop the medication. Please don't ever do that. Okay, epilepsy is not like your every kind of condition that you use the drugs, and because you think that you don't have symptoms again, then I don't need to use the drugs. No, even when the child is no longer having seizures or the person is no longer having seizures, we still keep giving the medication for nothing less than 2 years. So we'll give the medication for 2 years. And I know it's very frustrating for parents giving a child drug that it looks as if the child does not need it because the child is not having seizures, but we're still giving drugs. But please, we need to give those drugs for long. We don't give an anti-epilepsy drug for less than 2 years. And I'm talking of 2 years of no seizures. We're still giving the drugs. So that is how we do it. I have to talk to one of my patients who is a teenager, because it's a little bit more difficult for teenagers because they want to be like their friend. You can't always control them. So I have to tell them, look, if you have seizure now, you'll be embarrassed in the school, and then your exam, you have GCE and all that. So please, you have to take your medication. And what we try to do is to build it into a routine. So maybe as they are brushing their teeth, they take their medication, or as they're having, if they always have breakfast, they take it with their breakfast, maybe it's with the dinner. You have to make it part of their lifestyle so that it's not like I forget. You don't forget epileptic drugs. You don't take it anytime you like. If we say it's 7 a.m. and 7 p.m., it must be taken at those times. If you don't, or you suddenly skip it or you forget, the body registers it as if you suddenly stopped it, and then the seizures will come back, and it's usually worse. I think one of the parents was saying it yesterday that when she stopped it suddenly, now the child is having worse seizures, and now it's more difficult. They can't even get its control. It can be that bad. So please, this is not to frighten anyone, but please, when your child is on anti-epileptic drugs, don't ever stop it. Even if the child is sick, you give it. Even if the child will not eat, you give it. If the child is going for surgery and they said the child must fast, you must give the drugs. I'm sure the anesthetists will even tell you have to give them the drugs. The child is fasting, the child must take his anti-epileptic drugs. You don't fast your anti-epileptic drugs. That is the truth. So they must always take it. And like you said, even when they don't have seizures again, they must still take it. And you can't just say, oh, I don't need to see my doctors again because the seizures have stopped. You must always see your doctors every 3 months, because we need to adjust the dose based on weights and so many things. We need to check that the side effects are not causing problems, to the organs and all that. So you need to see us every 3 months or so, and you need to get those medication adjusted. And when we think the child has not had seizure for 2 years, and all the other parameters, EEG is not normal, everything is fine, there's no physical abnormality in the brain, and we're ready to stop the medication, then we do it slowly. And I'm very slow. I go over 6 months to stop my medication. Some people say 3 months, but it has to be done slowly. We don't just suddenly go stop. So we stop it slowly. And so usually I tell you, okay, go down to 4, maybe reduce 400 and so on. Usually I'll give my patient a plan on how we're going to stop it over the next 6 months. And once we stop, then we monitor, and hopefully most of our children are fine. Because the issue is that if you stop it suddenly or you are too fast and the child has seizure again, we are back to square one. We're still going to go again, and we're going to treat the child again, and we're still going to wait for another 2 years of no seizures before we stop the medication. So I always plead with my patients to be very patient when we're taking off the medication. All right, the next question: which hospital is recommended for the disease, please? Okay, there is no particular hospital for treating seizures, but there are doctors who should be involved. So most doctors, for example, most general pediatrician can treat epilepsy, but for the common, easily treatable one, sometimes your general pediatrician should be able to treat it, but the best doctors, especially for difficult ones, will be our pediatric neurologist or neurodevelopmental pediatrician. So these are doctors that are doctors for children. For children, for example, it has to be the pediatric neurologist or neurodevelopmental pediatrician. These are doctors who specialize in things that have to do with the brain. So we are the one that will treat children. For adults, that will be your neurologist. So neurologist, some psychiatrists also treat epilepsy as well. But I default more to the neurologist. pediatric neurologist, neurodevelopmental pediatrician. So most of these specialists, you find them in your general hospitals, in your teaching hospitals in Nigeria, in some private hospitals as well. So make sure you go to the right hospital. Okay, if you don't know where to go, just go to a teaching hospital, ask for the department of doctors that treat the brain conditions, epilepsy. Some people actually have epilepsy clinics, so you may want to go for those kind of clinics. Say someone said my neighbor's daughter is suffering. She's getting to 4 years now and haven't started school. Epilepsy doesn't stop a child from going to school. Epilepsy doesn't stop a child from living their normal full life. I will answer that question. I think there's a question on it further down the line, but please, general hospital, teaching hospital, epilepsy clinic, just ask for them and we'll be able to treat the child. Okay, thanks for this opportunity. Is it true that any seizure from the age of 4 years is not epilepsy? That is not true. Okay, I forgot to mention that it is not every seizure that is epilepsy. Okay, if somebody has seizure just once and it didn't happen again, we don't classify that as epilepsy. Okay, if somebody has seizure because of fever, and a lot of our children between the age of 6 months to 6 years, when their body is hot, very hot, they start to have convulsion. We call it febrile convulsion, febrile seizures. We don't classify febrile convulsion or febrile seizures as epilepsy because we know it's going to stop. It's going to stop. So we don't. So seizures without fever, we call it afebrile seizures. It has to be seizure without fever, and it has to happen at least twice or more, different times, so not the same day, twice or more different times, then we will call that as epilepsy. And there's no age. So epilepsy can start from the newborn period. It can start as an adulthood. It affects all age groups. So it is not only when it happens after the age of 4 years that is epilepsy. It can happen before. I have newborn babies who have epilepsy, and we have adults who have epilepsy as well. So any age group can be affected. Now, this question, is it communicable or only hereditary? Epilepsy is not communicable. So you don't get epilepsy by drinking from the same cup, or by using the same towel, or by using the same spoon or whatever of people that have epilepsy, or even when they foam. People believe that when they foam, if that foam should touch you like this, you have caught epilepsy. It's not true. You don't get epilepsy by carrying somebody who has epilepsy or by helping them. You don't get epilepsy that way. Now, is it hereditary? Now, epilepsy can be hereditary, and that's why I know most cultures, like Yoruba culture, for example, when you want to get married, you go and ask, is there people that have epilepsy in your family, blah, blah, blah. Yes, epilepsy can run in families, but it is not all epilepsies that are genetic. Okay, genetic is less than 10-25% of epilepsies. So several epilepsy, like I said, 50% of the time we don't even know what is causing the epilepsy. It's idiopathic. We don't know why. And 50% of the time we know why. So if somebody has an head injury and develop epilepsy, that cannot be genetic. We know why that child has epilepsy. Or if a child has birth asphyxia or severe jaundice or meningitis and develop epilepsy, obviously they didn't inherit the meningitis or whatever from the parents. So it is only a few cases of epilepsies that are hereditary. Most of the time, there is no cause, or the cause we know. Maybe there's a tumor, there's a stroke, or there's a so those ones we know the cause. So it is not all cases of epilepsy that are hereditary. When do we say one has it? When you have seizures, two or more seizures, then you have epilepsy. I know some people don't like the word epilepsy, maybe because of the stigma around epilepsy. So some people prefer we say seizure disorder, or fits or whatever, but say the same thing. Whether you call it seizure disorder, whether you call it epilepsy. I think more people prefer the word epilepsy because it's the most commonly used word anyway, but it's the same thing. So, excuse me, oh, somebody has seizures more than 2 times without fever, that is epilepsy. And what are the signs of it? The seizures are the signs of it. And what are the home remedies? Yes, my people in ATP, they love home remedies. And yes, there are conditions that have home remedies, but there are certain conditions that are no home remedies for them. Epilepsy is one of them. There is nothing you can do when somebody is having epileptic seizures, okay? Please don't put spoon in their mouth. Don't put stick in their mouth. Don't put onions. Don't burn their hands in fire. Don't do any of those things. You are making things worse. The best thing you can do for somebody who is having epilepsy is to leave them alone and make sure they don't hurt themselves. So if they have any tight clothes or chains or bangles, you can remove it and make sure that they don't hit their head. Make sure all the dangerous piece of equipment they are out. Take note of the time. How long is it taking for it to stop? Most epilepsy seizures will stop within 1 minute, less than 60 seconds. So, but if it's going more than 60 seconds or going to 5 minutes, you have to call the ambulance because they have to take them to the hospital. It's only at the hospital we can stop the seizures. We can give them drugs, usually most either injection or through the anus or something to stop the seizures, and then we can treat them. So you can't do more than that. There's no home remedies, and please do not give herbal remedies. Okay, can we isolate anyone with it? Please, you don't. You should not isolate anyone. That is part of the stigma and the stigmatization and the discrimination that we should all be moving away from. Let's make it epilepsy is just like any other disease, just like having, I'm short-sighted, I wear glasses. It's just the same way, or people who have diabetes or people who have asthma. That is the same way epilepsy is, just the way asthma is affecting your lungs, my short-sightedness is affecting my eyes. Epilepsy just happens to affect the brain. That's it. It's just the same, all these chronic conditions. So there's, just like somebody who has hypertension as well. So we don't need to isolate them. They are not contagious. So it's not an infectious disease, it's not COVID. So you're not going to get it. So please don't isolate them. Don't deprive them of going to school, of doing sports, of doing everything they need to do. So, and that's what are the possible causes? I think I've already answered that several times. So, is convulsion the same as epilepsy? Yes, this is another common question that we got. So, convulsion is a form of a seizure, okay? And in convulsion, it involves motor, it involves movements. So, it involves checking, could be checking, people start checking like that, and they jack with their both hands or their legs. Sometimes they go stretching like that. Anything that involves movements or the muscles, we call it convulsion. That is a form of a seizure. You can have convulsion without fever. You can have convulsion with fever. Convulsion with fever, especially in children, we call it febrile convulsion. That is, we don't classify that as epilepsy, but convulsion without fever, that is epilepsy if it happens more than 2 times. Now, there are other forms of seizures that are not the dramatic jerking or, falling and stretching and, stiffening and all that. There are other forms of seizures. There are seizures where the person just kind of blank out. We call it absent seizures. It's as if they are not there. You call the name, baby, baby, and they can't even respond. We call it absent seizure, and they just suddenly snap out of it and continue the same conversation. But if they're in school, they've missed half of what the teacher said, and they just carry on from where they stopped before they went into the absent seizure. So that is a form of seizure. So the person is not checking, they are not falling, they are not drooling, they just blank out. Okay, there are seizures where people just nod their head. Some seizures just they go into like what look like electric shock. We call it myoclonic seizure. They just shock like that. So that's another form of seizure. You have seizures where they just drop. It's as if they just fall down, for no apparent reason, as if of the muscle just become jelly and they just drop onto the floor. And there are seizures that manifest as behavior. They just start smelling something, or they start feeling something moving all over their body, all those kind of things. Some of them are having seizures. Some people say something is moving on my body, and people sometimes know when it's about to happen. They have what we call the aura. They can sense something is about to happen. Like somebody was telling me yesterday that a sister always have a seizure whenever in front of the bathroom or in the washroom. So what I'm suspecting is that child always have an aura, and maybe it comes as an urge to go and use the bathroom, and that is why seizures always happen. Then full seizure now happen after she's gotten to the bathroom. So there are different kind of seizures. So convulsion is just one of the seizures, but there are other form of seizures that don't involve checking or convulsion. Also, they are also seizures, and they are part of epilepsy. So at what age can one say the child has outgrown the epilepsy? There is no age for outgrowing epilepsy. So After we diagnose epilepsy, we treat the epilepsies and hopefully it will stop. So it is whenever it stops. And like I said, most of the time, once we get the drugs, we get the right dose, everything, most people will stop having the epilepsy. There are people you put them on drug day one, that's the last time they have seizures. Some people may take us a couple of weeks, months, even a year before we get it right and the seizure will stop. But some people, it's more difficult. So there's no age, there's no timeline for everybody that applies to everybody. No. But what I can say is that once the seizure has stopped, and for 2 years no seizures, and we are able to take the person off the drug and no more seizures, then you can now say the person has grown the epilepsy. Why is it that some children diagnosed with epilepsy cannot walk or talk at the appropriate age? Very good question, which is what I get a lot of this from the Super Parents Foundation. So a lot of children who cannot walk or talk, it's not the epilepsy causing that. It is whatever happened in the brain. The brain damage that is causing the epilepsy is also causing what we call this developmental delay. So it depends on which part of the brain is affected. So whichever part of the brain has that injury, it can manifest as the epilepsy, it can manifest as developmental delay, it can manifest as cerebral palsy. It depends. So most of those kind of children, there's actually something physically going on in the brain, or there's a genetic syndrome, or there is a malformation of the brain that is causing epilepsy, that is also causing all these other developmental delay. So it is not the epilepsy causing that, it is the injury in the brain generally that is catching many areas of the brain and is causing multiple issues for the child. Especially for children, this tends to happen a lot in children who really have severe significant brain injuries and damage. And so when you do a brain scan, you will see that there's a lot of things going on in this brain. All right. Why is it that some children who are epileptic, their own parents are not? Okay, this question comes from the assumption, a very dangerous assumption, if I may say, that you can only have epilepsy because you inherit it. And this is why our parents do all this, what they call fact finding, where if they think you have epilepsy running your family and they don't want to give their daughter to your own family so that your own children will not have epilepsy. It is not every epilepsy that is hereditary. Less than 25% of epilepsy are hereditary. So majority of epilepsy, we don't know the cause. Some of them, it is something that actually happened in this particular child. The child didn't cry at birth, the child had jaundice, the child had meningitis, the child had the head injury. That is why the child is having epilepsy. So the child did not inherit it. So it is not every epilepsy that is inherited. So if the epilepsy is not due to inherited condition, then the parent don't need to have epilepsy for a child to have epilepsy. And that is why that method of fact finding doesn't always work, because you may marry somebody who they don't have epilepsy in their family, but your own child can still have epilepsy. So that doesn't mean anything. Is seizure the same as epilepsy? Epilepsy means 2 or more seizures. So you can still say the same, but it is not just one seizure that will make it epilepsy. It has to be 2 or more seizures. What causes epilepsy? I think we've talked about it a lot. What could be the first aid treatment at home before going to the hospital? There's actually none. Okay, the most important thing is keep them safe. Keep them safe. Make sure they don't hurt themselves. Wait for the epilepsy, the seizure to stop, and then take them to the hospital. Some people who tend to have a lot of seizures, we sometimes give them drugs, like in the UK and some other countries, they give you drugs that don't require being swallowed. So you can put what we call buccal, midazolam, something you put in the mouth, in the cheek area, and the body will absorb it from the cheek, not from swallowing, because somebody who is having seizure cannot swallow anything, and you force them, they can aspirate it, and that will cause another problem on its own. So something they can swallow through a cheek. Some will give them something they can put in the bum, the rectal, the diaphragm, or wherever, so that is like an emergency thing before you go to hospital. If you don't have any of those ones, which we don't tend to have in Nigeria, because of the cost and all that, then what you need to do is wait for the seizure to stop, and then you take them to the hospital. Hope it's not hereditary. Epilepsy can be hereditary. Is there a way to prevent it? Yes, I think I should answer the prevention parts of the question, because it's also a very common question. The truth of the matter is, You can only prevent what you know is preventable. Everything is not preventable. 50% of the time in epilepsy, we don't even know the cause. So we can't prevent that. We don't know what is causing it. So how do we prevent it? But in the other 50% that we know, there are some that are genetic. We can't prevent genetic unless, well, once you have it in your genes, you can pass it on. So there's something we can do about it. But we can actually prevent epilepsy in 25% of cases. There are cases that are potentially preventable, and these are cases that have to do with brain injury, cases that have to do with things happening now and causing injury or damage to the brain. So we can prevent those ones. So for example, we can prevent head injury. So when I scream and I make a lot of noise about babies falling, this is why I don't want your children to have epilepsy. So all this mother that her baby is walking, you want your baby to walk at 9 months, 10 months, and you just want to force them to walk and they're falling a lot, or you just leave these babies on the couch anyhow and they're falling. This is why we always fight over that, because when those children fall, they can have head injury and then they can have epilepsy. So you don't want that. So please, all these, my baby is just falling, drop a baby and we just go out, it has to stop because of this risk. Okay, we can prevent accidents, road traffic accident. Please, let's make sure our children use the seat belts. The younger ones should use the buster seats, when they sit. Let's just not leave children in the car anyhow, just to be playing and moving. And no, they have to be 2 years old, you have to be in the car seat, well, restrained. The older ones, they have to use their booster seats and with their seat belts. The older ones, 12 years and above ones, use their seat belts, so that even if there's an accident, the children don't get thrown and hit their head against the car, or the chair or whatever, and that can cause that injury. Sports injury, if your children are playing all this ball, football, rugby and all that, please let them use their health shield or whatever shield. These are things that we have to protect our children from head injury. So if we protect children from head injury through all this method, we can reduce the epilepsy that is due to traumatic injuries to the brain. So we can prevent from the traumatic epilepsy from head injury. What's another thing we can prevent is that we can do perinatal care. This is why we want your baby to deliver in the hospital. We're not saying you're not going to deliver like an Hebrew woman, but sometimes you have delivered like an Hebrew woman, but the baby's brain is gone. So when the doctors say we have to take this baby out by CS, it's not because we know you, it's not because you can't deliver. It's because by the time you will deliver, that baby has suffered significant brain injury, and that is what we're trying to avoid. So when we say we have to do a cesarean, say, please just agree with us. It is not, I always say, mother, it's not enough to just have the baby. You will want to have a healthy baby with the brain that is intact. A lot of mothers go 3 days of labor. It's not acceptable. What are you doing for 3 days in labor? And it is the wisdom of God that we used to do cesarean sections. So please, actually, my Christian friends, let's stop that. I must now deliver by cesarean. Why? We just need the baby to come out without the stress to the brain. We don't want the injury to the brain. We don't want them bleeding in the brain. We don't want babies deliver preterm. We want to make sure. That's why you have to go for antenatal care. Some of us think you've had 2-3 babies and you don't take antenatal care seriously. You are joking with the brain of the baby. We don't want the preterm delivery. We want babies deliver on time, because the most important part of the brain we're worried about during labor is the brain. The brain is so fragile. 5 minutes of no oxygen getting to the brain starts to die. That is the truth. And that child can live with that consequence for all their lifetime. So we want a baby whose brain is intact. So please, no birth injury, register in the hospital. Don't deliver at home, deliver in the hospital, not at church, not at mosques, not at CBA. Go to the hospital so that they can monitor. Unless the nurses and doctors are coming to your house, that is fine. If a child has fever, give them paracetamol, and that will reduce febrile seizures. So let's prevent stroke. If we prevent stroke for the adult, this is more for the adults. Let's make sure our blood pressure are checked. Let's make sure our diabetes, we check for it, we control it. Anything that we can control, let's control it. That will reduce the risk of stroke, and that will reduce the risk of epilepsy from that. CNS infections, meningitis, there are immunizations, there are things we can do. The warming our children especially is important. I don't think I'll have enough time to answer all the questions I have, but we need to, I'm happy I'm taking this part on prevention. So we need to prevent infections in the brain. So that's why we sometimes give us all this meningitis vaccine booster. Please, let's take our children for this immunization. So we'll prevent them from having this infection in the brain, and we can prevent them from having epilepsy. All right, so there are still loads more questions on epilepsy, which I really wish I can handle. Some of them I've answered it on our group. Maybe I will do another part 2 and answer the remaining questions, so that I think it's important for us to understand. But summarily, epilepsy is very common. It's not contagious, okay? You don't get it by being in the same room or breathing the same air or sharing items with the person who have epilepsy. Epilepsy has to do with the brain. It has to do with abnormal discharges in the brain causing seizures. Good news, we can actually treat epilepsy. And children, adults with epilepsy can be free from seizures. The important message I want to do with us is that if you know somebody who has epilepsy, because it will amaze you how many people have epilepsy, but they are not even being treated. And that's because people believe, oh, it's spiritual or it's somebody witchcraft. No, please take them to the hospital. There was a lady I met, I think she was 30 or so. It's a good news, so I'm going to share it. And she just messaged me on Facebook and like, sisters had epilepsy for the wow, adults, epilepsy is treatable. I think she was even in Benin. I think I remember her, she said she doesn't mind coming to see us in Lagos. So I remember sending her as one of my adult friends who is an adult neurologist. And the child was treated. I mean, she was a lady, she was treated, and 2 years or so later, the sister sent me a message saying, oh, my sister has been seizure free now. She's not even married. She has a baby. I was so excited. I was so happy because that's good news. So please, epilepsy is treatable. Come and see us in the hospital. Go to the teaching hospital. Go to general hospital. Ask for the epilepsy clinic. Ask for the neurologist, pediatric neurologist, adult neurologist. Let's get treatment. And please use your drugs and be patient. It's not a 1 hour, it's not a 1 day, it's not a 1 week. We are doing 2 years, we are doing 3 years. Please be patient. If you work with us, we can stop the epilepsy and the child can be, or the adults can be seizure free. Okay. And for those few cases that can be a little bit more difficult, please go to the adults go to the neurologist and we'll be able to answer that. So I think what I'll do is I'll do a second part 2 recording of this episode so that I can answer the remaining questions because there are so many of them. But if you still have any questions as well, feel free to post it on our Facebook group and we'll be able to answer them. Thank you so much for listening and for joining me today. I'll see you same time next week where we do the concluding parts of this episode. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.